We are talking about lisinopril. What exactly is lisinopril? So some of you guys might even be on lisinopril. It's a medication and it's used for different things. Most common use is going to be for high blood pressure, but it's used for other heart diseases too. It's used to treat heart failure, which is when the heart is weak and not pumping too well. It does that. Also, if somebody's had a heart attack, which is also known as an acute coronary syndrome, they're often put on lisinopril too, because that helps out with the heart function after having a heart attack. And a lot of times too, the heart attack may have been associated with high blood pressure, for example. And it's also used for other reasons, but commonly it's used for high blood pressure and then to help with heart function, and it's used for heart failure. It belongs to a class of drugs called the ACE inhibitors, and that's what we commonly call it in the medical field. ACE stands for angiotensin converting enzyme inhibitor. So that's the class of drugs that it belongs to, and that kind of tells us a little bit about what it does. The way that lisinopril works is it acts on a substance in the body that actually constricts blood vessels. And so when the blood vessels are constricted, they're smaller, and then the blood has to kind of use more force to get through and push oxygen throughout the body because oxygen travels in blood. That's what the lisinopril does. It helps to widen the blood vessels. And so by the blood vessels getting wider, then the blood pressure drops. And that helps to improve blood pressure and increases blood flow to different organs and oxygen getting to the heart, which is a good thing. I actually have a little analogy or a little demonstration for you guys, and you can go ahead and practice this tiny little science experiment at home if you'd like to. But this right here is a little straw. Can you see it? Ah, there it is. Okay, so this is a little straw. This is one of those like coffee stirrer straws or like one of those cocktail straws. And as you can see, it's like really tiny. The diameter is really tiny. Just try this yourself. Like I mean, have you tried to drink coffee with this little straw or like the cocktail with the little straw? You kind of have to use more force to get the fluid up. And think about our bodies. We've got blood vessels throughout our body, and this is relatively large. But we've got blood vessels of different sizes. We've got blood vessels everywhere, even in our eyes. So, I mean, obviously in our eye, the blood vessel isn't this big. So there's like tinier blood vessels where there's even more pressure if it gets constricted. So it gets even smaller than its small size. That's this one. And then think about a different straw. So this is kind of like your standard straw. And now you kind of see there's the diameter is wider, and so it's a little bit easier to drink with this straw. You can try that at home. And then this is an even bigger straw. This is kind of like one that's used for like things like boba. That's that drink with tapioca. If you've ever had it, you get it at Asian stores, and then you suck up the tapioca balls. But this is pretty huge, as you can see here. And actually, this other straw can fit through here. So this is kind of a pretty big diameter, and we've got some big blood vessels in our body too. Like for example, the aorta, which is the big gigantic blood vessel that travels from our abdomen kind of up to our heart. It's probably around this size, and then this tiny little one fits in here. So that's just a little demonstration for you. So the wider it is, the more dilated it is, the easier it is for blood to flow, and it decreases the blood pressure. So we talked about what the medication is, what it does, and then there's some common side effects that happen with lisinopril too. And lisinopril, like I said, it's in the class of ACE inhibitors. So anything that ends with "il" is going to be in that same class. There's captopril, there's enalapril. If you're on something that ends with "il," typically it's got an ACE inhibitor in it. And sometimes there's combination drugs too. So one of the most common side effects of an ACE inhibitor is going to be a cough. And it's a dry cough that doesn't go away, and it can last for a while. That's one of the most common side effects. And basically what happens with that is we just switch you to a different medication. a different blood pressure medication and the side effect goes away in a couple of weeks if that is indeed what is causing the problem. There are other things that can cause a chronic cough, but ACE inhibitors is one of them. And actually, the drug manufacturer and like research papers and stuff, about 40 to 20% of people have that side effect. And I can tell you just in my own practice, that's the most common side effect that I see with lisinopril is going to be a dry cough. Doesn't mean that you're going to get it, but it's common. Like some people are on it and then nothing happens, which is good. But if that happens, then we just switch it. Since it's a blood pressure medication, it can cause hypotension, which is low blood pressure, which is the blood pressure is dropping below normal. And if your blood pressure is really, really high when you start it, chances of that happening are not that great, but depending on what the blood pressure level is, and for some people, they've got a different kind of response, that can happen too. And associated with low blood pressure, one of the symptoms of low blood pressure is dizziness, and that's a symptom that can happen with this too. And so that goes along with maybe the blood pressure is dropping a little too low. So if you're on a blood pressure medication, especially if you're just started on it, usually your doctor or provider will tell you, monitor your blood pressure at home, bring your log with you. Or if you notice changes, it's a good idea to have your own blood pressure log and just be checking your blood pressure. There's other side effects that can happen with medications. I'm not going to be able to go over the full list with you here because it can be pretty extensive. That doesn't mean that you're going to get it, but it's just something to know. And there's always less than 1% that can have strange side effects. It can actually cause gastrointestinal side effects like diarrhea, constipation, or bloating. That is not very common. I've only had one person come to me and tell me that lisinopril actually caused them to have diarrhea. Now let's get into some major side effects that can happen with the ACE inhibitor class and lisinopril, which is an ACE inhibitor. This medication helps to protect the kidneys too, but sometimes it can cause problems with kidney function too. When you're on these medications or just medications for your blood pressure, there's blood work that's being done every so often, and we're actually looking at your kidney function. And then if you notice all of a sudden you're having problems urinating, and that would be an issue to bring to your doctor. And we already look at what your kidney function is before we start you on the medication. So it's a risk versus benefits type of deal. There are benefits to being on this medication, but we know that it can have potential side effect on the kidney, and we're monitoring for that. Now, a really, really serious side effect, which is a medical emergency 911, is going to be angioedema. And this is swelling, which happens in the lips and the throat in that kind of area. And that can that can lead to the throat closing up, which is bad because then you can't breathe. And then that leads to death if not taken care of quickly. It's 5 times more common in African Americans. And the reason being that African Americans have a genetic predisposition to have lower levels of certain enzymes that are used to break down bradykinin. And this is just a molecule that the ACE inhibitor drugs act on to cause vasodilation, so widening of the arteries. That's what bradykinin does. So there's higher levels of bradykinin in people with ACE inhibitors. But then if those levels aren't going down and things are just wide, that's when you start having problems with angioedema and swelling. And so here's another important thing that people don't realize. You can be on a medication and just not even medication, just in life in general, and develop an allergy to anything. But in this case, it would be a severe side effect. So you can be on this medication for 20 years and nothing happens, and then one day something can happen. So we can develop a side effect to any medication that we've ever been on at any point in time. It doesn't matter how long we've been on it. So it can be the first day, it could be 10 years later, it could be 20 years later, it doesn't matter. And then sometimes nothing happens, but side effects can happen at any point in time. I actually have a little story to tell you. So it was during the pandemic, right? And so remember during the pandemic, everybody was wearing masks. I happened to be working in urgent care, and I had this female patient, and she was actually Caucasian. So this doesn't just happen in Black people, but it's 5 times more common in Black people, especially if there's a family history. So anyway, this was a Caucasian lady, and she came in and she said, I can't remember what it was exactly, but it was like she was having like problems with talking. It was some weird symptom where you wouldn't think about a lisinopril side effect if you're not like looking at the medication list. But she was like, I've been having problems talking for a few days, and I started looking at her list and she was on lisinopril. She was wearing a mask. And so I said, can you please take off your mask? I want to look inside her mouth. And her lips were swollen, and she did not tell me that fact. So, and this had been going on for a few days. So, needless to say, that's a medical emergency and it can get worse. So, that lady was sent directly to the emergency room because she needs to be monitored for a couple of days to make sure that doesn't get worse. Because once the swelling in the throat happens, it can happen like that. And then by the time the ambulance gets to you, it might be too late. That's just one of the common side effects with it. And just usual dosing of lisinopril, it starts out with about 10 milligrams per day. A maximum dose is 40 milligrams per day, and that's for adults. We're not talking about kids here. I treat adults, not kids. So kids like a totally different dosing. And another important thing to know about lisinopril and the ACE inhibitor class, if a woman is pregnant or planning to get pregnant, then she can't be on these drugs because they can cause problems with fetal development. So that's an absolute contraindication. That's a little overview for you of lisinopril and blood pressure medication in the ACE inhibitor class. And make sure to share this information with somebody who needs it. And if you want to work more closely with me, definitely send me a DM and we can talk about how we can work on maximizing your metabolism to help you reverse type 2 diabetes.